Hello, everybody. Welcome back to the Now What podcast. I'm your host, Arian Foster, a.k.a. the Pod God. We're working on that. We don't know if we like it or not yet. But so far, so good. We have another special guest in the building. I appreciate you taking out your time. My apologies for the lateness. I made you get up early this morning, and I was late, so my apologies. It is Courtney Miller-Chism, and she is an assistant professor of hematology and oncology at Baylor College of Medicine.
That's correct.
How are you doing?
I'm good. How are you?
I appreciate you, man. Like I said, I was late this morning.
No problem at all.
You know how it goes, man. We on CP time. Feel me?
Yes, I feel you.
but no, I appreciate you taking out time to come and rap with me. I think that we can have an interesting conversation, especially for my fan base, man. So your expertise is in hematology and oncology, which, and if I'm butchering it, let me know. Which is, you should just tell us, because I'll mess it up before you will.
Sure. Yes. So I am a hematologist oncologist. I've been in this field now for 6 years. And that's basically it. I really don't have an area of expertise within hematology oncology. I have a little bit of a special interest in specifically hematology. And I think one of the questions that a lot of people have is why hematology oncology is lumped together. And part of the reason is because oncology, first of all, I guess understanding what hematology oncology is the first question.
That would help.
So hematology is the study of blood disorders. And then oncology is essentially the study of cancer. And there are multiple cancers that involve the blood system. And really, when you think of what cancer is, first of all, cancer is the abnormal growth of abnormal cells in the body. And essentially, any cell in the body can turn into a cancerous cell where it loses the normal morphology, or like the normal appearance of a normal cell, and turn into what we refer to as a malignant cell. And that basically means that the cell is now abnormal. And when these abnormal cells develop, they start to grow abnormally. And so with cancers, we talk about tumors. And what that is essentially abnormal growth of a bunch of abnormal cells. And so and
do they grow on each other? I'm extremely ignorant when it comes to cancer, which is part of the reason why I wanted to have you on.
Sure.
Because cancer gets thrown around a lot and everybody talks about it, but
Yes.
I don't think a lot of people actually know what it is. And I've done my fair amount of research on it, but I'm still not 100% sure. So a tumor is an accumulation of cells that basically are growing, like they're not supposed. Are they? So cells are supposed to die, correct?
Yes.
And these cells don't die, so they're kind of like immortal cells.
Right. So the body is pretty smart when it's working normally. The immune system is one of the aspects that kind of immune system, along with other aspects of the body, keeps cell growth in check. Okay. And so once certain cells have a certain lifespan, then essentially they die. But the special thing about tumor cells is that they will start to grow sort of unchecked. To where they can continue to grow and populate and turn into abnormal cells. And that check system that typically would keep them in line now is lost for different reasons.
Right.
Part of it is related to the fact that maybe the immune system, which is able to recognize abnormal cells in the body and clear them or get rid of them, for some reason may not recognize the cancer. Then there's other ways in which genes have different signals, and so our genetic makeup has signaling so that it turns on and off cell growth. Right. And now some of these triggers are kind of lost, and so now the signals that would turn off growth are now activated, so that now we're not turning off the growth of cancer anymore. The signals that would typically lead to death of cells now is completely abnormal as well. So there are different mechanisms behind cancer.
So that's interesting because like cancer kind of gets lumped into this all these cancers are very similar when in fact they're so totally different.
Absolutely.
Because different cells have different abnormal growth.
Right. And each cancer is very different. They're all treated differently. And it's not uncommon that we'll have patients coming in with experiences of family members that have had cancer, and they'll say, well, I saw this family member go through treatment and they did horribly. It made them worse. And so I don't want treatment because of this experience. And one of the first questions we'll ask is, well, what type of cancer did they have? What type of treatment did they have? Maybe the treatment wasn't the same as what we're going to treat you with.
That's important, though. That's super important, and why I feel like I want to do my due diligence in getting a little bit of a clear understanding of what cancer is. For that exact reason, a lot of people, especially in our communities, have a huge distrust with doctors because they just don't understand the basics of what they're even dealing with. So they go to people like yourself and that study this stuff. And they have no idea what they're talking about, but they just feel, and I'm trying to do my best to try to get people to understand, like, do your research on whatever the case may be, before making any brash decisions. Absolutely. Because it's something that could help save people's lives.
Yes.
I want to dig into the cancer thing a little bit more. Is there, okay, so since it's such a wide range of issues dealing with cancer, when people do these walks and these cancer walks and these things, do these are we close to getting like a cure of or not a cure, but like a better understanding or a cure for cancer?
That's a good question. And it's a good question because it goes back to a point that you just made, that there are many different types of cancers. So when we're talking about a cure for cancer, that is complicated.
Yeah.
Because each cancer has its own set of mechanisms that allows it to exist.
Right.
And each cancer has tons of researchers trying to work on that particular cancer. And sometimes different aspects of one cancer to try to fight it.
Is it quantifiable, like how many different type of cancers we've seen? Like we know there's X amount of cancers, or is it just new ones keep coming up? And
for the most part, it is quantifiable, but every once in a while we'll come up on some cancers where we don't. I won't say that we don't have an entity for it, but we do run across some cases where we're scratching our heads sometimes. But for the most part, it's fairly quantifiable.
So in the case of something like I forget the name, I think it's lymphoma.
Lymphoma.
Is that the one? Is that the cancer of the blood? Is that?
It is, okay, right. So we were getting to that, and I kind of got sidetracked.
No. That's what podcast is for. Explore.
Yeah. So this is one where hematology. It's a hematologic cancer.
Right.
So lymphoma is a cancer that is essentially of the lymph nodes.
Okay.
And so the blood cells migrate to different portions of the body. And so our lymph nodes are essentially made up of some form of a blood cell. And they can abnormally grow. And this is what causes us to have this blood cancer called lymphoma. Mm-hmm. So oncology by itself.
Real quick. It's not like your blood itself that has, I don't even know how to frame this now that I know a little bit more about it, but like it has actual cancer. It's the lymph nodes.
It's interesting that you ask that, because sometimes we can take a look at a sample of blood underneath the microscope and we can identify cancer cells in the blood.
Really?
Yes.
So, I mean, what differentiates a regular cell versus a cancer cell in the blood?
It can be by the appearance. So when we're looking at cells underneath the microscope, you're purely looking at the way they look, and that's all we can do. There are other special tests that can be done in the lab to identify the makeup of the cell and determine if they're cancer cells or normal cells.
Is it predicated on like how they react or how?
It's really all about the makeup. Okay. So we have special tests in which we can identify like different proteins on the cell, and if a normal cell will have a certain makeup, and then cancer cells will have a different type of makeup.
Gotcha.
So, lymphoma, for example,
Right.
typically these are patients that will develop abnormal growth of lymphatic regions. So if you have lymph nodes all over your body,
Right.
they filter a lot of junk and trash, some infections, basically. And when these areas start to swell up, sometimes it's normal. It's just in relationship to an infection. But if it's due to an infection, they'll often swell up slightly and then go back to normal once the infection is cleared. But if you start to notice a growth, persistent growth, or an abnormally large growth of some lymph nodes, which can be in the neck area, in the armpits, in the groin, then that should raise a raised flag and definitely should cause one to seek attention.
Is there, aside from tobacco, is there demonstrably identifiable things that we consume that are 100, like that, like if you do this, it will trigger you developing some kind of cancerous cells?
Yes. So alcohol is a trigger.
That sucks.
Yes. Excessive amounts, right?
Okay.
So, there are some studies that have shown that alcohol has positive effects on the health, like wine, for example.
Really?
Yeah. But in general, excessive alcohol use can be...
Define excessive for those drinkers out there.
So, we were always taught in medical school when we're assessing social history.
Right.
If you're drinking, it's been a while now since I've thought about this, but as for a male, greater than 14 drinks per week, or for a female,
what constitutes a drink?
It doesn't matter.
Just a sip. Okay.
Well,
or like an actual gulp. Gotta be specific here. I'm trying to save my life.
I think it's 8 ounces if I'm not mistaken.
8 ounces. Okay.
8 ounces.
We'll go with that.
Yeah. And 14 drinks. It doesn't matter, because some people think, oh, that's only hard liquor. But even a beer is still considered an alcoholic drink. And anything over 14 is considered excessive for a male. And I think it's like 10 for a female. Yeah.
So you can't gauge it off of how drunk you get. You have to gauge it off of the actual
content. But no one's really measuring typically how many ounces.
It's a real thing. Yeah. All right. So you got alcohol. Is there anything else?
So there are different infections that are associated with cancer. So that's not necessarily intake, but I think it's still important, because especially with STDs, for example, that's something that's preventable. And so there is an infection called HPV.
Yeah.
And there's been a lot of discussion about the vaccinations in younger kids, and a lot of controversy, divided really among moral and political lines, what's most appropriate, but very preventable. And so HPV is associated with different head and neck cancers, and it's also associated with cervical cancer as well as anal cancer.
Wow.
Yeah.
I had no idea.
Yeah, it is.
That's so wild.
Right.
How are they linked?
So with the head and neck cancers, it's actually through oral sex.
Really?
Yeah.
Wow.
Yeah. So it's something you probably wouldn't even think of.
I have never thought of that.
Right.
That's insane.
Right. And so they interestingly, they tend to be good prognosis cancers. So they respond quite well to treatment.
Right.
But yet it's still something that's preventable.
Right.
And so I think, safe sex is real.
For sure.
Yeah. And so I think that's really important.
100%. Okay, so we have alcohol, tobacco, oral sex. Is there anything?
I know. Yeah. That's one.
Taking away all the fun of life.
Diet is really tricky, because that's a question everyone comes in. And in fact, when people are diagnosed with cancer, that's one of the first questions they have when we start talking about initial treatment is, what do I need to do about my diet? And so I think we have scattered research that have showed possibly some link with questionably sugary foods. But the truth of the matter is there's nothing definitive out there.
And see, that's where the conspiracy theorists go wild right there, because that well, we're not 100% sure. It goes into, well, they don't know.
Yeah.
And I tend to lean more towards, like, I'm a huge advocate for science and research, because even if it's not the correct answer 100 years from now, it's the best possible answer that we had at the time. So it's the most rational discourse to
Absolutely.
take. So any kind of advice from medical professionals, I take it. And you have, like you said, you have like anti-vaxxers, and you have people who don't subscribe to the same worldview. And I'm not judging you. I'm just judging you.
Which is fair.
It's just not a rational way to live, I don't think. Like, to pretend like I know anything about oncology or hematology, it's ridiculous. I don't know enough. And I could read an article that has clickbait. You're kind of a victim to whoever wrote the article's
Absolutely.
agenda. Like, you're a prisoner to that. And so like you have to do your best to sift through all of that nonsense. I'm unclear as to why hematology and oncology is linked. I know you probably said it, but can you?
No, I don't think I quite got there.
Okay.
So let me say one thing, that there is an aspect of hematology that's considered benign. Okay. So this is not cancer.
Right.
An example would be sickle cell disease.
Right. Okay.
So this is, abnormal red blood cells that under stress they sickle, and what that means is that they become deformed. And when the body is under stress, for example, if there's a lack of oxygen or if there's dehydration, then these abnormally shaped cells start to stick together and they start clogging up the vessels. And that's where the pain crisis come in, so that these patients are in pain because their vessels are blocked and they're not getting good blood flow to different aspects of the body. Is it
like a blood clot? Is that what that is?
It's not really a blood clot. It's different.
Jesus.
But there is some clot. It's a form of clotting process to it, per se. So that's sickle cell disease, benign hematology process, but yet it's still part of the hematology oncology.
Right.
But then there,
before we pivot from that,
yes,
because I want to clear up what I thought. This is from what I've read. There's kind of a misconception that with sickle cell, it only affects, or the majority who get affected are African American, and I don't think it has anything to do. And this is, correct me if I'm wrong, but what I read was that it didn't have necessarily anything to do with Black people in general, but it's because of wherever like malaria was prevalent. Way back when we were evolving still, and you become more susceptible to having those issues. Is that correct?
Yes. Okay. No, that's a good way of explaining how our actual it's a genotype, so it's a gene abnormality.
Okay.
Yeah, how it kind of developed over time, and so with the prevalence of malaria in Africa, that has a good reason for why we see this predominantly in African Americans.
Right.
But then you also can see sickle cell disease in Middle Easterns,
right?
Which a lot of people are surprised by,
right?
But it's there.
I just want to clear that, because a lot of people think, just only Black people get that. It's not the case. It just had to do with where malaria was prevalent.
Yeah, I mean, and as a result of this, it does still.
It does, but it doesn't have anything to do with us in general. It's just
right. There's some
products of your environment.
Method behind.
Yeah. Okay.
Yes, okay. You're correct about that.
So, and you were saying, where were you about?
We were talking about hematology and oncology.
I blocked your pivot.
Yes, and so basically, the abnormal growth of blood cells is a cancer too.
Right.
And so, because hematology is involved in the blood cells, there is some overlap in oncology and hematology. So oncology, like I said, is the study of cancer. And typically when we're talking about oncology, medical oncology, you're thinking about solid tumors. So when we say solid tumors, we're talking about breast cancer, lung cancer, prostate cancer, organs, right? But Then there's also the blood system that can be involved with cancer too, and that's the hematology aspect of it. So you can be an oncologist who take care of predominantly blood-related cancers such as lymphoma and leukemia. Those are the two main cancers that are under the hematology umbrella.
Okay. So which one directly piques your interest?
I really like lymphoma and leukemia. I like both of them. And I actually still like a little bit of benign hematology as well.
Is there a reason a specific reason you got into this field? Because we haven't dug into your background really, but is there a reason why you chose this?
It's a very interesting story. And when I was about 10 years old, I was watching some movie. I still somewhat remember it was a Sunday night, and it was a movie about a pediatric oncologist taking care of some leukemia patients.
Really?
Yeah. 10 years old, right? And so I saw this movie and I was inspired.
That's wild.
Yeah, I told my mom I wanted to be a physician, and we went off with it. So I attended the DeBakey High School for Health Professions, which is a high school here in Houston, and it's specifically for high school students that are interested in medical professions. Doesn't have to be doctors, but also nurses, pharmacists. And so I attended there, and then I went ahead still with the intention of going into medicine. So this has been really like a childhood dream come true.
Literally.
Yeah.
That's so dope, though. You don't hear a lot of 10-year-olds wanting to be a physician.
Yeah. And it's interesting because, this was like leukemia, hematology, oncology back then, but that wasn't something I necessarily wanted at the age of 10.
Right.
I thought I may have wanted to be a pediatrician at first because, of course, I was a kid. So I was like, okay, kids. Then I realized, kids are cool, but I don't know if I want to be around kids all day.
100%. I got 4 of them. I don't want to be around them all day.
Exactly.
You said something interesting when we were talking off camera. You said that when you were first getting into your field, you graduated with a degree in mathematics. Am I?
Yes.
Okay. And then you said that you don't have to necessarily graduate. You don't have to go to undergrad to attend medical school. Or is that correct?
No. So you can major in anything you like.
Okay.
Yeah.
So you can major.
But you have to get a bachelor's.
A bachelor's.
It could be a bachelor's of science. It could be a bachelor of arts. It could be whatever you like.
So but it has to be in that field.
Yes.
So why mathematics? That's interesting.
I love math.
All right.
In high school, I had a mathematics teacher who told me that she thought I would do well in math. And so I was like, okay, sure.
Right.
And so I did. The interesting thing was if I don't go into medicine, I'm not sure what I'm going to do with this mathematics degree.
Right.
Except teach high school, but that's not something I felt was my calling.
Right.
But it was still intriguing and fun, at least during undergrad.
How much is that? How much is math applicable into what you're doing?
Not much. Not much at all. I think there are certain aspects of medicine. Maybe there is a field called radiation oncology, which we work very closely with this specialty. And they're the doctors who deliver radiation to our cancer patients. I think that maybe it would have had a little bit more applicability to that field, but it has pretty much zero applicability here.
That's a good pivot because I want to talk about that a little bit. What exactly is radiation? So when somebody says that they're going through radiation or chemotherapy, like, can you break down the differences of what exactly it is?
So there are different treatments for cancer. Chemotherapy and radiation are pretty much the two main therapies. Surgery itself is a treatment as well. So when a person has cancer, one of the first things that we need to know is the stage of cancer. Okay. And so each cancer has different stages. It's a little bit trickier with the blood cancers. So the leukemia, lymphoma, a little bit different. But if you're talking about those solid tumors like the lung cancer, breast cancer, prostate cancer, you want to know if the cancer is localized to one part of the body or if it has spread.
Right.
So chemotherapy is what we refer to as a systemic therapy, which means that the treatment actually goes into the bloodstream and is able to travel throughout the body.
What exactly is the treatment?
So it's an IV. It's an infusion.
I didn't even know.
Often. There are some pill forms of chemotherapy, And more recently, we're starting to develop some subcutaneous where you can put an injection right underneath the skin. But the majority of chemotherapy treatments are delivered in the vein. It looks like if you're in a hospital and someone's getting chemotherapy, it looks just like it's a medication that's dripping into the IV.
Wow.
You wouldn't be able to know that it's chemo.
So what is the actual
function?
Yeah, like what is it? What is going into the patient?
So it's chemotherapy is directed towards killing cancer cells. And so it pretty much goes to the level of DNA of these cancer cells. And there are different mechanisms for each of the different chemotherapy agents, but essentially they're killing tumors, killing cancer. But the problem or the side effects that's associated with it is that in addition to killing the cancer cells, it also has effect on normal DNA in the body, and that's where the side effects come in.
And that's where people lose hair and things like that. Wow.
Exactly.
Okay.
Yeah. Whereas radiation is only a local therapy. So when you get an X-ray, for example, that's a little bit of radiation therapy. Small, tiny doses. Right. But when you're giving radiation, you're taking that little bit of radiation you get with an X-ray and you're magnifying that to this one particular part of the body where the radiation therapists have like identified where the cancer is locating it and targeting it to that one area.
Right.
So when you have a patient that has early stage cancers, the mainstay of treatment is often to cut it out if you can. So take them to surgery.
Right.
And then depending on how aggressive the cancer is when they take it out, and when I say aggressive, this could be how it looks under the microscope. So how angry it appears. That could be one of the things we use to define the aggressiveness.
Is how rapid it grows?
Yeah, it could be. A lot of times it's how different it looks from a normal cell.
Right.
So there's something called differentiation. So if it's well differentiated, it still looks somewhat like the normal cell, but you can tell it's different.
Right.
But if it's poorly differentiated, that means that it looks almost nothing like the normal cell.
Okay.
And then there's some where there's like you can't tell where it even started.
Right.
There are cases like that. So that could be.
That would be.
Yeah, no, it's tough sometimes because it makes treatment difficult when you don't know where the cancer started. And there are cases when we have that.
Right.
So that's one of the things that we use to determine how aggressive the cancer is. The number of lymph nodes around the cancer is also helpful in determining the aggressiveness. So if there are lymph nodes involved, we know that the cancer has now started to spread. It's on the move. It's on the move like in that region of the cancer. But when we do CAT scans, we're wanting to see if the cancer is spread to other organs or if it's still just hanging out in the area where it started.
Right.
But if it's in the lymph nodes, that could be a potential good indication that it could be in the bloodstream as well. So when we start seeing lymph node involvement, we'll follow up surgery, sometimes with chemotherapy, just to get rid of any cancer cells that we may not be able to see with the naked eye when you take the patient to surgery.
Right. Jesus. I'm gonna pause it and say thank you so much for all this information. I didn't know a lot of this stuff, and it's just interesting stuff that you don't think to ask unless you or one of your family members is going through it.
Right.
And it's just good to be aware. Because if you feel any kind of ailment or any kind of anything, you can be on top of it
right away.
And this is something that affects everybody, all across all political spectrums. Doesn't matter what you are. This is something that we're all kind of fighting together. Is there a percentage as far as how well each treatment works, and like what? I guess it would be different to specific cancer. Right.
But you were asking about lymphomas earlier, so we can talk about lymphomas. Yeah. So with lymphomas and with leukemia, I'm going to piggyback because even though you didn't ask about leukemia, I think it's an important one to discuss too. So leukemia is interesting in that this is a cancer where you may see a little bit of lymph node enlargement, but sometimes you don't. It's a cancer that really is involving the bone marrow. So it's interesting because you don't really see the cancer. And sometimes patients will tell you, like, I feel good, but we may have some indication that they're not very good. And often these patients will come in possibly with some weight loss, and they'll come to our attention because maybe now they're really anemic because the bone marrow is the place where you make all of your blood cells. You make your red blood cells there, your white blood cells, and platelets. Platelets are helpful with clotting. So whenever you scratch yourself, I call the platelets like the first responders, almost like EMS, where they come to plug up the areas so that you won't exsanguinate.
The only time I've ever heard platelets was when I was playing ball. They had this new form that they were kind of like testing out. There was this new form of treatment. So where if I had like a soft tissue injury, they would take some of my blood, spin it, and isolate some of the platelets and inject that back into the area. I mean, I did it a couple times, and they were like, "How do you feel?" I was like, "I don't know, bro." But I had no idea how to gauge.
Like what exactly?
Yeah, I didn't know what you were doing, so I couldn't tell you if it worked or not.
Right. Yeah.
Does that make sense that they were doing that?
I don't know a lot about that one, actually. So I wish I could comment on it, but I can't tell you a whole lot about it.
Doing crazy shit.
Well, platelets play a role in the immune system also. Right. And so I can see how maybe as a part of repair,
right,
that it could have been helpful.
I was a guinea pig.
I didn't say that.
I was. I'll say it. But no, you were talking about
leukemia.
Leukemia.
So when you have anemia, basically those.
What exactly is anemia? Because I've heard it plenty of times, but it's just never.
So it's when the red blood cell count is low.
Okay.
Right. And so if you're not making enough red blood cells, which could be for different reasons,
right,
then your hemoglobin, which is a reflection of your red blood cells in the body, will go low. And you may start feeling symptoms like fatigue, shortness of breath. When it gets really low, sometimes dizziness, chest pain. And the reason why the red blood cells are important is because it delivers oxygen to your crucial organs in all parts of the body.
Wow.
And so now you need those cells to deliver oxygen to your crucial organs. And if that capacity of delivering oxygen is now down, then you start to have symptoms.
That makes sense. So how many? You have red blood cells and white blood cells.
White blood cells and platelets.
And platelets.
Yes. And then
that's what makes up blood. Is there anything else I'm missing?
Well, there are some other things too. Okay. So when we were talking about of the white blood cells, there are different types of white blood cells. And there are some cells called lymphocytes, which is the same cells that are part of the problem with lymphoma. So that's where there's kind of like now there's this overlap.
Got you. That makes sense.
There are also some more cells part of the immune system as well. So but those are the main things. There's plasma, which is more of like the sort of liquid part of the blood.
I thought that was the whole part.
Yeah. So then there's whole blood.
Right.
Yes. And so in the plasma, then you have something called clotting factors. And so those are your factors that work with the platelets to help with clotting. So that again, like if you have a scratch or if you have a cut, then all of those, the clotting factors plus the platelets work together to prevent you from bleeding out.
I'm so thankful for people like yourself. Because like this is so deep and it's so intricate, and it's something that I would never even thought have to study. And you're saving people's lives and you're helping make a huge difference. It's so admirable, man. Thank you.
It's fun.
No, for sure.
Yeah.
Do you ever feel a sense of like, kind of like when you see behind the curtain, like, cause you kind of understand the way things work. I noticed that about like, I was watching like some interviews from some physicists, and once you kind of see behind the curtain of how like life works and how things move and it kind of gives you a different perspective on how you view life. Like how has that perspective changed in you?
Gosh, tremendously. I mean, one of the things when you walk into the hospital every day, and when you're taking care of cancer patients, I mean, your perspective is completely different, right? That bad day that I thought I was having is not bad anymore.
Right.
When I'm having to, tell an 18-year-old sometimes or a 22-year-old who has kids at home that their cancer is not curable.
Jeez.
And we're fighting to keep them alive for another year, maybe just to be with their kids.
What kind of things do you have for people or suggest for people who get that news? Like, because it literally changes your life.
It changes your life. You know, well, I think you have to have a support system.
Right.
And that sounds easy, but I don't know if it's always easy for certain people.
Right.
You know, I think that there have been patients that I've encountered before that have come in alone and I've had to give bad news to. And that really breaks my heart because I just feel that you should have someone there with you. But even if you don't have the family support, I think there are plenty of support groups. So my advice would be, you need a support system.
Right.
With whoever, whatever that support system may be.
Right.
This is not something you want to fight alone.
Right.
This is too challenging emotionally, physically, for one person to have to fight this alone.
100%.
So you got to seek out a support system.
And we say this a lot, and this has everything to do with a lot of what we go through as humans. Not necessarily just this, but also this, is when we say you have a support group or support system, what does that mean to you? You know, because a lot of people don't know how to support. Like, I recently went through a family issue where somebody said, "I need you to support me," and I said, "How?" And they were like, "I don't know." And I'm like, "Well, I don't know how to support you if you don't know exactly what you want." And we're just kind of like at this standoff. So, in your opinion of somebody going through something like this or anything really, like, what does support mean? I know it's a deep question because it's kind of subjective, but I think we gloss over words a lot in this society.
You know, honestly, I think you hit it on the nail. I think when someone tells you you need support, they do have to know in what way.
Yeah.
Because I think that often we feel that we're supporting people and it may or may not be what they need.
Exactly.
So I think if you have someone that you are trying to be support for, I think the first question is for that person, tell me specifically, what can I help you with? Being concrete about how someone can be helpful is what's needed in a situation like this. Yeah. It really is subjective. I don't know. It's different for different people. Right. I think what I haven't really talked about is the fact that with Baylor College of Medicine, all of my clinical duties are in the Harris Health System. Mm-hmm. So Harris Health System consists of Bentop and LBJ, which are both county hospitals within Harris County. We have a large indigent population. We deal with a lot of different social challenges. Our patients have many social challenges. Some of them have problems getting to and from their appointments. Some have difficulty getting to their infusion appointments, their chemotherapy appointments. Yeah. And so for one patient, it may be, hey, I need you to help me get to my appointment, right? I mean, that's a very concrete thing. Mm-hmm. And maybe that's not easy for their support system either. They have to work. But I mean, I think just identifying what ways in which other people can support you will help your support system be more effective.
That's an interesting aspect that you bring up. Beautifully put, by the way. But the healthcare issue in this country, I don't know if you want to get into it because it's politics and everything, but it's something that I've always took for granted in this country because I played college ball. Mm-hmm. And so from the age 17 to when I left at 22, 23, I had all my medical stuff. I never had to worry about if I was sick. I went to the trainers and the trainers put me in touch with the doctors. I never had to come out of pocket. I didn't understand it. And then when I went straight from that to the NFL, same situation. Right. We had the best healthcare that money could buy. And so I never have put in any thought into healthcare until I retired. And granted, I'm still on that same healthcare plan. It's just something I've never crossed my mind. I was like, get a doctor, whatever. But people are really struggling with this issue in today's society. And I've dove into it a little bit. Mm. But I think I have it down a little bit. And basically what it is it's either like socialized healthcare. One side says that healthcare is a right. You deserve to, and the government should facilitate some of that.
Right.
And other side says, no, you need to work for your own. And am I get? I mean, I don't.
You're right.
And that notion to me is wild because I didn't know how much of a political point it was. And just being a regular human and a humanitarian, I would think that you would. I don't mind paying an extra whatever amount of tax so that somebody else can have that coverage. But people do. I don't know where you stand on it, but
no, I mean, so in an indigent population where we sometimes are not able to give our patients the standard of care. And when I say standard of care, I mean that these are guidelines now that tell us that once this patient's cancer does XYZ, this is the next step, right? And we know this because research has shown that this is the best way to go, right? And I am happy that in many cases in Harris Health System, we are able to give even a patient that's below poverty line excellent care. Right. There are still some aspects of care we cannot offer.
Wow.
One of those being
that shit is heartbreaking.
Yeah, it is.
Wow.
It is. So one of those being like bone marrow transplant, stem cell transplant, they're the same thing. This is a type of treatment that we offer for patients with leukemias and lymphomas. And ultimately it can get a little bit more without getting into the details. What you're doing is you're taking the patient's stem cells. So stem cells are what I like to call like the parent cell. They're responsible for making all those blood cells that I was talking about. It starts up here at the parent cell, and then from those parent cells is where you get all your different types of cells that we were discussing, along with cells involved in the immune system. And so when we have cancers that do not respond to our initial chemotherapy, or when we have very aggressive cancers at diagnosis, sometimes we need to do stem cell transplant, in which we get either stem cells from the patient or we get stem cells from donors to help with treating their cancer. Okay. And so this is something that is an expensive procedure. It also has complications, and so it requires a lot of monitoring and care after the transplant is done. And so even in our system, in which we're able to do a lot for patients, we don't offer that. And so to think that we have patients who are unable to get access to that treatment because they don't have insurance. We have a large Hispanic population that we take care of in Harris Health, and they don't have access. If they are not citizens, they don't have access to this either. It's pretty heartbreaking. And so I don't understand how we as Americans, who should value all lives, you know? I mean, it's the cliche these days, right?
Seen it on a poster.
Yeah,
too.
Exactly, right? But how we are okay, how we can go to bed at night knowing that there are people out there who are dying because they just don't have enough money to get the care they need.
Man, it really hit me this last year when I was digging into healthcare and what is the big deal? Why is everybody talking about healthcare? And I don't understand it. And granted, I don't fully understand the budget. I don't understand what we're spending money on. Who knows all of that? But I would think that we have some kind of funds allocated to people.
Right.
This is I had an idea back in college, and I think this is a great idea. Is we spend so much time honoring the past, right? We have all these days. We have MLK Day. We have Columbus Day, which we shouldn't. We have all of these, all these days, and it's just honoring historical figures, honoring the past, honoring this. We need a day that everybody takes off of work, and we celebrate us in the now and the future of us. Why can't we celebrate? And I think that mindset is the reason why we don't have something like socialized healthcare is because we don't really live here. We're always living either there in the future or the past.
Right.
God, I'm just went on a little tangent. I'm sorry. It's heartbreaking. I see that shit. Oh, sorry. I don't know how you're. This is not a family friendly podcast. What is the kind of consensus of that in medical profession, the field actually? Like, what are the people's thoughts on that? Like, I mean, everybody has their own for sure, but like, is there like a majority of us kind of feel the same way?
Honestly, I would say that when you go to the majority of healthcare societies, so each subspecialty or specialty and subspecialties have their own entity that represents that particular specialty.
Right.
And many of our mainstream medical societies as a whole have support for overall universal health care.
They advocate for it.
I mean, it's just, I know that every physician doesn't. I know that for sure. Right. But
what is the counter argument? And they're basically saying, like from a physician standpoint, like I shouldn't have to work for the government, or what is their actual, or do you even know? I don't want to put you in a position.
Yeah, I think it's hard for me to comment on that.
Right, no, for sure. No.
Yeah. Because I'd probably want to do some research.
For sure. I wouldn't have you out here. No, for sure. I just like to explore all these topics, man. It just it makes zero sense to me. Like I don't understand how we can have paid. You can police my neighborhood, but you can't take care of the people in the neighborhood. It doesn't make sense. If we're gonna have socialized programs, let's have socialized programs. I don't know. I don't want to get you caught up in the politics of it.
Yeah.
If somebody is going through the unfortunate circumstance of they found out that they have cancer, what is that? Well, first of all, let me ask this: why is Houston like kind of the hub for cancer research? Like you hear that a lot. Like people go to Houston for this. Why is that the case?
Well, the Texas Medical Center is one of the largest and well-established medical centers in the United States. And it's known for that. I mean, we have many large hospitals in the medical center, and we have one of the among like the largest cancer centers at MD Anderson in Houston as well. And MD Anderson is definitely ranked as one of the top cancer centers in the United States. So I think that plays a large role.
What makes it a top ranked one? Is it like their conversion rate or what?
Yeah, it's a good question. But the research.
Okay.
They have a lot going on from a research standpoint.
Okay.
And that plays a large role.
So is there light at the end of the tunnel that you've seen?
I would say there is. There's definitely been significant growth within the last 10 years.
Right.
And I can say this just from going from my years in training to now my years as faculty member. There have been significant gains in certain cancers within the last 5 years. We've had a lot of new drug approvals. And I don't know, are you familiar with the term immunotherapy?
I've heard of it.
Yeah. So this is like a big buzz that's going on in the cancer world right now. In fact, everyone's super excited about it. Mm-hmm. And basically what that is giving therapy. It's not chemotherapy now. So we're talking about a non-chemotherapy option in which the body's immune system fights the cancer. So remember, we were talking about earlier how one of the ways in which cancer grows is because the immune system is not able to check the cancer and get rid of it.
Right.
And so now if we can somehow wake up the body's immune system to fight the cancer, it's pretty effective because that's what should have been happening in the first place. Right. And now we're talking about less side effects, though there are some side effects still associated with immunotherapy. It's well tolerated in general. There are some like I said, it has side effects, and there have been fatalities related to this treatment, as with all treatments. Right. But overall, well tolerated. patients are starting to live longer as a result of this treatment.
Wow.
And so there are different immune mechanisms in which the researchers are targeting to improve cancer treatments
Right.
throughout all of the different cancers. And I think that's been one of the big growths within the last 5 years.
That's awesome. That's great to hear.
Yeah.
I have to double back on this, and I should have said it when you said it. What exactly is the immune system? People say immune system. System. What exactly is the immune system? Like,
So kind of going back to those blood cells we were talking about earlier.
right.
The immune system consists of different cells that recognize foreign parts of the body and get rid of it. So
they like attack it.
Yes,
Okay.
it's an attack on whatever the foreign system is, which often, in our cases, in healthy patients, you're talking about those infections. So you get an upper respiratory infection, for example.
Right.
It's a virus in many cases. Sometimes it's a bacteria. Typically with bacteria, you need more like an antibiotic to help the body's immune system. But sometimes you just don't have treatments. It's just you need the immune system to recognize that this is foreign, fight it, and get rid of it.
Right.
Okay.
Is that why sometimes you have blood transfusions? Sometimes the body rejects.
So it is, yeah. That's the immune system playing a role.
Wow.
Yeah. So what happens over time is if you've had multiple transfusions, there is a possibility that there's some foreign antigens that the body may not vibe with.
Right.
And over time, your body can now develop antibodies. So the immune system now recognizes this as being abnormal, foreign, and then when you get transfused with a component of that blood later on, the immune system will rev up.
So what's the point of blood types? If your body rejects the same blood type?
These are minor.
Oh.
They're minor. So there's like major blood types per se, and then there's like a minor antigens. It's kind of like a formal term, but these are more minor. So we don't see this too often.
Gotcha.
Yeah, and the major blood transfusion reactions can be fatal.
Wow.
But there's specific testing done to really eliminate that. So on rare occasions, due to some error that may happen, but ultimately we shouldn't see major blood transfusions.
If I'm type O or whatever, I should react well to a type O blood transfusion.
Oh yeah, absolutely, absolutely.
And what are the variables? So excluding error, is there any other variables that you have to account for, like to be worrisome about?
It can get kind of complicated.
Right,
I mean,
okay,
but in general,
you break out the textbook.
right. So in general, there's type A, type B, type AB, and type O.
Oh, that's it?
Yeah.
I thought there was more.
Those are the basics.
Right.
Those are the major blood types. But then there are some little small ones. So if there's a person that's been transfused multiple times, that sickle cell disease patient may be one who may have gotten multiple transfusions for different reasons. That could be a person who could be at risk for transfusion reactions beyond just the major antigen. So ultimately, I mean, there's also those very, very, very small risks of infection transmissions, because this used to be a concern definitely with hepatitis, HIV back in the 80s. But the testing that's done now in the lab is very intricate and able to essentially pick up any infection.
I've noticed that. I'm not sure how your familiarity with HIV. I mean, you work with blood, so I'm pretty sure you're pretty familiar. But like, I've noticed that the scare of HIV isn't as prevalent. I mean, still wear condoms or whatever. But I'm saying the scare of it isn't as like it was when I was growing up. When I was growing up, it was like if you get HIV, that's the death sentence. Whereas now you see people living with it. I mean, my uncle. He has HIV, and he's been living. I've known about it since the 90s, and he's still out here doing his thing.
HIV now is recognized as a chronic disease, just like diabetes, hypertension, because the treatments they have good treatments for it, and the main thing is just staying compliant with the treatment.
Right, and it's like I think they say taking the cocktail. I think they call it the cocktail.
Right.
Wow.
So if it's a different disease from 20 years ago.
Wow.
Yeah.
You still don't want it though.
Still don't want it. Still don't
For
want it.
sure.
And you know, we still see patients who die from complications
Really?
related to HIV. Yeah.
It's an interesting. It's amazing how all this stuff is kind of connected.
And there are some cancers that are associated with HIV
Really?
for the reason of the impaired immune system. So because the immune system is impaired in HIV, that increases the risk for cancer.
Right. Wow, it does.
Yeah.
Because you hear about that growing up. It's like it's not really the HIV that kills you. It's something else that your body can't fight.
Right.
That's interesting stuff, man. This all has been educational. I highly appreciate you, people in your field, and just people like you in general who have an interest in this stuff, who are out here, really kind of altruistically saving people. You know, and of course you get a paycheck from it, and you get but it's something that needs to be done. I mean, I just think 60 years ago, where medicine was and where it is today, and how much people have sacrificed and how much people have done in the course of that work just to get us to where we are today, where people have that hope.
Right.
So I appreciate it.
Yeah, no, I mean, I'm happy to be here. I mean, this is obviously something that I enjoy. I enjoy taking care of cancer patients.
For sure.
I wish that we could save them all. Unfortunately, we can't.
For sure.
But we sure try our best. And I think with the research coming, I mean, I was just doing a little bit of research because I was going to talk to some medical students about who's interested in hematology oncology later on today.
Right.
And I think that the American Society of Clinical Oncology, this is specifically an oncology-based professional organization, they postulate by, I think, the year 2020, there's going to be a huge deficit in cancer doctors. And the reason why is because patients in general are just living longer. And then our cancer patients are living longer as well. So I think that's something that is...
Well, that's interesting.
Yeah, it is. It is.
So is that... Oh, wait, hold on. Let's back up.
All right.
Because you hear a lot of, especially from like conspiracy theorists,
yes,
that big pharma's keeping. How much of that is...
You know, I don't... I've wanted to comment on some of these Facebook posts I've seen before, you know.
I'm off Facebook. I can't do Facebook anymore.
But, you know, some people get really upset, you know, because there is this concern that you know, pharma is responsible for they're basically holding out on cures for it because they're the money that's being generated from the treatments is the reason, but that's not it.
You know, so
it's not it. It's just these cancers are very complicated.
Right.
Like I said, a lot of people think of cancer as just like cancer.
Right.
That's it. It's cancer. There's a couple of mechanisms that's causing cancer, and all you need to do is just target those, and then we're good. It's over. But that's not it at all.
So the only thing that identifies each separate cancer as being under the umbrella of cancer is the fact that it's cells that won't die.
It's an abnormal growth of cells.
Right.
Yeah. And essentially they're cells that are not dying.
And
so typically what happens is when a person comes in with a complaint or an abnormal growth that they could see, you do CAT scans and you do a biopsy. And the biopsy is essentially sticking a needle into that tumor and looking at it underneath the microscope. That's when the pathologist says this looks like a cancer cell, and they do some additional tests to support that it's a cancer cell.
Got you.
And then that's the diagnosis.
Right. Man, that's interesting stuff, man. There has to be some kind. I mean, because just thinking back to the whole big pharma thing, and there's definitely like lobbyists that lobby for things in Congress and things like that to keep certain medicines on our shelves. Like the FDA isn't angelic. You know?
I guess at the end, show me a system that is.
That's true.
But I think that ultimately, when we're talking about healthcare in general, I mean, so the pharma companies consist of, obviously business-minded people, but there are physicians there as well. And when we all take the Hippocratic Oath, your hope and your prayer is that we are abiding by that oath. Right. And that, if we have some information that we're withholding, or we would not withhold information that's going to be crucial to the advancement.
Right.
I mean, I think there's so much, from a physician standpoint, there is so much to gain from the knowledge.
Yeah.
First of all, the notoriety for that person, even though they're probably not seeking that. But right. I mean, if you have some great answer for how we're going to combat cancer, there's definitely incentive for getting that information out there.
That's the part of the conspiracy theory that doesn't make any sense to me. Is if you really wanted to make money and you're holding back these cures, you're hurting yourself, because you can be one of the most famous people on earth.
Yeah, absolutely, absolutely.
I actually ran a Twitter poll one time, and it got like over 10,000 votes, and this shit blew my mind. Somebody said if you had the cure for cancer, would you make it free? Mm-hmm. And there was so many people that said no, and that shit blew my mind. It like, that's wild to me, because it's indicative of the society we live in. But it was my hard work, and I'm like, yeah, but like, yeah, curing people, like, how much money do you need? Like, there's no way, like, if you just in this hypothetical scenario, there's no way that you can't have a book deal and you'd be set for life. Like, you wouldn't pay for another thing ever if you had the cure for cancer, quote unquote. Right. There was this guy by the name of Jonas Salk, and he had the cure for polio. Like, he found the cure for polio. I'm pretty sure you know all this, but for people that don't know, he found a cure for polio. And he gave it out for free. And when somebody asked why he gave it out for free, he said, I'm a butcher, but he said something along the line of like, the sun isn't mine. He's like, this isn't mine. He said, nothing is mine. He's like, this is for everybody, right. Which is a small little beacon of light in the world that we live in today.
Right. Let me give you another aspect though of pharma, because I think a lot of people view pharma as negative, but going back to
give me a positive one.
Yeah, let me give you a positive. So going back to our patients that are taken care of in the Harris Health System, as I was telling you, it's an indigent population typically. Mm-hmm. They don't have insurance, but the county is able to support some of these patients, but the county can only support so much. Right. And so right now we have patients that are on drugs that cost thousands and thousands and thousands of dollars. Right. And the reason why is because all of these pharma companies have patient assistance programs in which, if they see that you only make a certain amount of money and can't afford insurance and can't afford their drug, then they provide the drug through the patient assistance program.
So it's like they subsidize it. That's beautiful.
Things you wouldn't know. So
big pharma ain't all that bad. How about it?
I mean, awesome. so now it's like, with patients in the county who, let's say lung cancer, for example, all of these therapies that are classified as immunotherapy. I mean, these drugs have only been approved for like the past 5 years or so. Some of them are still being approved, like literally within the past couple of months. These drugs cost, tens and thousands of dollars. Right. And our patients are coming in getting it every 2 weeks for no cost at all.
That's beautiful.
So, I think that the pharma gets a lot of negative publicity.
Definitely.
But clearly they're helping a lot of our indigent patients.
Two sides to every story.
Yeah.
Got to hear both sides. Word of Jesus, man. Well, damn, this has been, like I said, man, this has been extremely educational. I appreciate it. I hope people out there get as much from it as I did, because it's part of the reason why I started a podcast, was to talk to people that I normally wouldn't frequent and just gain as much insight as I can from them, because I'm trying to grow. I'm just doing it on camera.
We're all trying to grow.
100%. 100%. Last little question is if you have, as you're in your profession. So are you extremely cognizant of the things that you intake and the things that you put into your body? Like, are you reading the back of every label? And
I could do better.
You do that? I'm with you.
Yeah.
I'm with
No,
you.
I clearly can do better. I really do think that there is some link with diet and cancer.
Right.
I just don't think we have all the answers yet.
Yeah.
But there are associations. It has to be. I mean, we're seeing colon cancer, for example. It's being diagnosed in much younger patients, sometimes in late 20s now. That's
Really?
pretty scary.
Yeah.
And so you have to ask yourself, what is it? What's going on? What's different? And I have to think environment is playing a role in different ways. But I think diet plays a role.
Shit, I have all these questions that keep popping up, and we're gonna keep doing it. We're gonna keep pump faking people. Do we know like the rate that different animals get cancer?
I don't know that answer.
Got you. Because that would intrigue me as far as just like a juxtaposition with human beings, because I think a lot of the reasons, well, I don't know shit about shit, but it would make sense to me that a lot of the reasons why is because of our own inventions and what we intake. And as like if an animal's eating whatever he's supposed to be eating and drinking whatever he's supposed to be drinking, it wouldn't be as prevalent. But if it is, that would be interesting.
Well, especially with veterinary medicine and its advances, because it's pretty amazing. Like I hear stories about dogs being on dialysis, dogs getting cancer treatment, getting chemotherapy. Wow. And I recently have a friend that I work with who told me that her dog was just diagnosed with liver cancer. So, I mean, it's there. There. I don't know. I think it's hard to tell because the access of healthcare for animals is probably not it's probably not as standardized, I would say.
No, for sure.
I mean, some people are like, okay, the dog died and they don't know.
I'm like that.
I'm
like that. I got a dog and my lady, she loves him to death, and I'm just like, it's cool that you like your dog. Like, it's cool. But she got animal health insurance for him. Like, you could have dog insurance. And I was like, what the fuck?
Yeah, no, it's crazy.
I had no idea that was a thing.
It's there, yeah. No, I think it's crazy too that somehow, I mean, of course you're paying for it out of your pocket, but it's like there are dogs who have insurance and there are humans that don't have insurance. God. Like, how is that possible, right?
Yeah.
And I bet that some of those people who will get insurance for their pets are some of those same people that's like, I don't want, for humans to get insurance. I think it's pretty sad, to be honest.
No, 100%, 1,000%. That's hilarious, though. Rather have Fido having insurance than your fellow human. That's crazy, man.
Right.
Well, damn, we could talk for a while, man. I really enjoy you. I really enjoy what you do, man. Is there anything that you want to plug? Is there anything that people find you on Facebook or Twitter or Instagram or whatever? Are you on these platforms?
I'm on Facebook, but it's more of like a personal, and I'm barely posting.
I got you.
I'm not really much of a poster.
So we'll just there will be no @ sign for you.
I'm sorry, I'm not one of those.
It's all good. It's all good. But we do end the show the same way every time. Since its inception, about a year ago, actually. So we're about a year in. Mm-hmm. My mother was my first guest, and from her to we've had Snoop Dogg, we've had everybody on. They all ask Jim Carrey to get on the show with me. So that's been the reoccurring theme on the podcast. I love Jim Carrey.
Yes.
He has a lot of those big pharma opinions, but I just want to dig in his brain. I think he's a brilliant human being. On top of that, me being a big fan. So we ask everybody to look in the camera. We're going to put a little compilation video together. Just do your thing to advocate Jim Carrey to come on my show for me.
All right.
I appreciate it.
All right. It's been a pleasure sitting here talking to Arian Foster and Jim Carrey. I think it would be worth your while if you were to come onto the show.
There it is. I appreciate it. Short and sweet. So if they want to find you, don't. She wants to remain anonymous. I appreciate you coming on. Thank you so much for your work and your time in your field. It's the altruism is shining through, and I appreciate it.
Yeah. Thank you for having me.
For sure.
Happy to be on.
For sure. You take care.
Thanks.